COVID-19 hospitalizations reached their highest peak yet this summer, driven by the spread of the highly contagious Delta variant. Inside Cleveland Clinic hospitals on our Treasure Coast, it's a 24-hour fight against the virus, where patients are younger, sicker, and unvaccinated. I sat down with 4 healthcare leaders at Cleveland Clinic Indian River Hospital to get the big picture of COVID's toll on the hospital system. At Cleveland Clinic hospitals, it's patients first. That principle hasn't changed in the COVID pandemic, even as healthcare systems struggle to survive another wave of outbreaks.
It's been most pronounced in the last 8 weeks.
And explain that. Explain why.
Just because of the magnitude of the surge. I mean, this surge has been far more extreme than any other surge that we've seen. It came on far more rapidly.
The incremental increase in our volumes is up more than 700% from the July nadir that we saw earlier this year, from 30 to 35 patients up to a peak of 395 patients.
Is this surge because of the Delta variant, right? And then is it the excess number of people that have to come into the hospital and are that sick because they're unvaccinated?
87% of all patients admitted to our hospitals with COVID are unvaccinated. 87%.
COVID-19 patients are also younger, sicker.
1 out of every 4 patients admitted to our hospitals ends up in the ICU. 1 out of every 3 patients admitted to our hospitals requires some form of respiratory device to help them breathe.
And they're taking up nearly half of hospital beds.
And no diagnosis should take up 40% of our occupancy in our hospitals.
Do you have some days where you just don't have enough medical personnel to handle the influx of patients?
Yes. And when that happens, we pull our resources. I myself have gone home, other leaders, to sleep for a few hours and come back in and work the night shift. We make it happen.
But there's a number of areas in the hospital where we're short of critical resources. We've relied on travelers. We've done everything we can, but it's an ongoing daily challenge.
The travelers Cleveland Clinic Martin Health President Rob Lord is speaking of are travel nurses, and they're being used to fill what the Florida Hospital Association calls a critical staffing shortage.
And we've been fortunate to have a number start recently.
Traveling nurses typically sign 3-month contracts for significantly more pay. It's probably costing you more.
In my system alone, over a couple $1 million every month, extra in wages.
Cleveland Clinic is also losing its own nurses to high-paying travel jobs.
I've had several of them tell me that when it's over, they hope to come back, and I'm sure we'll welcome them.
What do you want to say to people right now who don't understand that this is as enormous as it is and deadly?
Hospitals are not an inexhaustible resource. Understand, if we all don't do our part, we can overwhelm a system to the point that, and we were there, I have been there, we can't provide the care that we need to provide regardless of your condition.
We are not here to tell anybody what to do. We are here because we want to see everybody safe. And right now, the way for everybody to stay safe is to get vaccinated, to wear a mask, and to socially distance.
There are signs of hope as hospitalizations are down across the state. For those on the front lines, that is something to hold on to during the long days. And that's part of our story that will air tonight on News Channel 5 at 11.